Assalamualaikum everyone. Now I will explain Al-Razi's contributions to medicine. Al-Razi made many important contributions that influenced both Islamic and modern medicine. First, he established pharmacy as an independent profession, separating it from medicine and helping pharmacists become recognized healthcare professionals. Second, he wrote famous medical books such as Al-Hawi and Kitab al-Mansuri, which were widely used by physicians in both the Muslim world and Europe. Third, Arazi also contributed to physiology and psychotherapy by emphasizing the connection between the mind and the body through his work at Tib Ar-Ruhani or Medicine of the Soul.
In addition, he promoted experimental medicine by testing medicine and observing their effects before using them on patients. He was also one of the earliest physicians to use opium as an anesthetic during medical treatment. Finally, he encouraged the use of chemical and mineral-based drugs, which helped advance pharmaceutical science in Islamic medicine. In conclusion, Al-Razi's innovation laid a strong foundation for modern medicine, pharmacy, and medical research.
The first debate is the prophecy debate, philosophy versus revelation. Al-Razi placed great importance on human reason or akal as the main way to discover truth. He believed that morality and knowledge could be understood through logic, observation, and rational thinking. Some historical reports also suggest that he questioned the necessity of prophets, arguing that human intellect alone could distinguish right from wrong. However, many Muslim scholars rejected this view, stating that revelation or wahyu is essential because human reason has limit, and prophets are needed to guide people in matters beyond human understanding. The second debate is the cosmological debate, which focuses on Al-Razi's theory on the five eternal principles: God, the soul, matter, time, and place. According to this theory, these five principles are eternal and fundamental to the universe. However, many scholars criticize this idea because it appeared to challenge the Islamic belief that Allah alone is eternal and the sole creator of everything. Lastly, the third debate is alchemy and political suspicion. Al-Razi was a pioneer in chemistry and alchemy who developed laboratory techniques, classified chemical substances, and carefully documented experimental procedures. However, during his time, alchemy was often viewed with suspicion because it was associated with secrecy and the possibility of misuse. As a result, some rulers and political authorities became critical of his work, and his experiments were sometimes misunderstood, despite their significant contribution to the development of modern chemistry.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Aini Irtina binti Muhammad Fauzi and my metric number is 1250918. Today I would like to share 4 key reflections from the life of the great scholar Al-Razi. First, in the field of science, we must emphasize careful examination and logic before jumping to any conclusion. Second, balance of mind-body. We need to understand that the balance between the soul and the body is crucial. True, perfect health is not just about physical well-being, but it must include mental balance as well. Third is the value of persistence. Even when Al-Razi suffered from vision problems and eventually became blind from a lifetime of intense reading and writing, he never stopped contributing to science. This shows us what true dedication looks like. For humanity and conclusion. Finally, Al-Razi teaches us about generosity and humanity. He famously treated poor patients for free, inspiring us to use our knowledge to serve society regardless of their financial background. Thank you.
Now, let's look at the lasting impact of Al-Razi from history to today. First, Al-Razi was the first scholar to clearly distinguish between smallpox and measles. He explained that they have different symptoms and shows that smallpox is more dangerous because it can cause severe scars and has a higher risk of death. Second, he introduced the use of alcohol as an antiseptic to prevent infection. Today, this practice is still widely used in hospitals around the world. Besides that, his books Al-Hawi and Al-Mansuri became important medical references in Europe for centuries. He also introduced this bedside learning, where medical students learn by treating patients. Today, this continues as clinical clerkships or housemanship. Finally, Ar-Razi contributed to chemistry through his book Al-Asrar. He described laboratory tools and chemical processes like distillation and filtration, which are still used today in medicine, the petroleum industry, and perfume production.